Hi everyone, my name is Megan Farraher and I am here today to present to you why mental illness is an important healthcare topic and some of the interventions that can help address the issue. I will mainly focus on the lack of available treatment for all demographics across the United States. Mental health is such an important aspect of public health because it affects everybody. Mental health is just as important as physical health and must be managed and cared for in the same way. Mental illnesses are interesting because they consist of so many different symptoms, some much more severe than others. Mental illness is also very common. The latest data suggests that 1 in 5 American adults experience some form of mental illness each year. This is a healthcare problem because mental illness can lead to a host of other physical illnesses, including but not limited to cancer, coronary heart disease, diabetes, epilepsy, HIV/AIDS, and stroke. Those living with severe mental illness die on average 25 years before their peers without mental illness, and this is often from preventable illnesses. In addition to the debilitating effects of the individual with mental illness, there are also economic effects. Mood disorders are the third highest cause of hospitalizations in the United States. Those experiencing early signs of a mental illness may not seek help immediately. Often, they may not recognize the symptoms and attribute it to a temporary mood swing. Only 41% of U.S. adults with mental illness seek treatment. This may be due to its stigma or to the lack of access. It's important to have treatment available as soon as people feel ready to seek help. I am proposing that we increase the rate of sites with walk-in services. Currently, only 31% of healthcare facilities across the U.S. offer psychiatric walk-in services. It is important to increase the amount of facilities that accept Medicaid, which is currently less than half. African Americans and Hispanic Americans receive psychiatric services at half the rate that Caucasians do. One way to increase this number is to provide more diversity in the staff at hospitals and clinics. Unfortunately, there is often still a stigma surrounding mental health. This is why, when people work up the courage to seek help, it needs to be available for them. Another issue to focus on is the high rate of co-occurring substance abuse disorders. These disorders, coupled with the already stigmatized mental illness disorders, creates an even smaller window where people will be sober and feeling ready to seek treatment. This is another reason that walk-in services are important, so people can at least feel connected to some organization as soon as they are in need. If you think about it broadly, nearly everyone is a stakeholder in the mental health discourse. However, this chart shows a few of the most impacted stakeholders. Healthcare professionals are largely affected by the mental health of their patients. As mentioned previously, mental illness is often co-occurring with other chronic health conditions or substance abuse disorders. Additional stakeholders include government agencies such as the Department of Health and Human Services, local policymakers, insurance companies, and pharmaceutical companies. A third group of stakeholders include any social service agency that provides supports for this population. This can include case managers and social workers. And of course, the most affected people would be people in the lives of the individuals with the illness. These include family members, friends, employers, and landlords. This infographic reviews some of the data covered in this presentation. As mentioned, 1 in 5 adults in the U.S. live with a mental illness. 31% of adults experience an anxiety disorder at some point in their lives. This number may be much higher if each individual who ever experienced an episode of anxiety were included. 82% of those living with bipolar disorder live with severe impairments. Perhaps if services were available immediately to those experiencing signs of bipolar disorder, this percentage may be decreased. 6.7% of U.S. adults report having major depressive disorder. Again, this number is only what has been reported and does not include every adult who has ever experienced depression. The estimated average years of life lost in individuals with schizophrenia is 28.5. Despite the growing need, there are not enough resources for everyone with diagnosed and undiagnosed mental health disorders. 56% of adults with mental illness do not receive treatment. Half of those with mental illness have a co-occurring substance abuse disorder. 13% of all mental health facilities do not accept Medicaid, and across the U.S. there are about 6 times the amount of patients to every 1 mental health care worker. While many facilities offer outpatient, inpatient, or residential services, there are not enough resources for individuals who feel that they need immediate services, especially when they are experiencing symptoms of mental illness for the first time. This pie chart shows the percentage of facilities providing psychiatric walk-in hours in various regions of the U.S. To sum up, mental illness is a large problem in our country, and it often leads to other health and behavioral problems. The best thing that we can do as public health professionals is to ensure that services are readily available at every stage of need. This concludes my presentation. Thank you for listening.